It's a fairly new role for us. And when I got here in Montana about 13 years ago, there really weren't many people using anything that looked too much like a community health worker. But in around 2015, there was a pilot project that was funded by the Federal Office of Rural Health Policy and CMS for Frontier Care Coordination. And it tested using part-time CHWs in critical access hospitals and had great outcomes, and word of that spread quite a bit throughout Montana. And then more recently, a project funded by the Robert Wood Johnson Foundation and CMS with the Mountain Pacific Quality Health Foundation was very highly evaluated and structured, and they have really tracked the outcomes from that, and it was very, very successful in using community health workers in care coordination and clinics. And then we have been conducting workforce assessments every few years, and there are people who are doing community health worker type roles in SNAP, senior centers with maternal child health. So there's a lot of things that are very CHW-like that have been going on in the state. We convened, very much like Kylie, a CHW stakeholder group starting around 2015. We had some funding from the Montana Healthcare Foundation, Department of Labor, TACCCT, we made a lot of jokes about that name, grant is a big grant to develop the healthcare workforce in the state. And then we used some of our area health education center funding, and we used that to create a community health worker curriculum. The interest was really growing. We had one meeting where we actually had to take down the divider walls and expand the room because we had so many people show up to talk about community health workers. So it was getting very exciting in Montana. We used the curriculum consultant Sue Rowe, who also worked with Minnesota to develop their curriculum. And the stakeholders were extremely involved in identifying all the competencies that would go into the curriculum. And it is available we're training everybody right now online, but we also have the option to do it in person. These are our modules. They look probably pretty familiar to anybody who's looked at community health worker training anywhere. Kind of how you organize it in a lot of ways. And we have a 25-hour supervised experience at the end. We use the American Public Health Association definition of CHWs. We aligned our curriculum with other national models. We looked at what other people were doing, and the CHW Core Consensus C3 project. I want to call out the Washington Department of Health was really, really helpful to us in explaining how they delivered their training and how they developed it. And so we are in debt to them for their help. And then more recently, we just crosswalked the curriculum with a community paramedicine curriculum, which is, of course, a whole other topic, but I'll explain why we're interested in that. We manage the curriculum and online training through the Montana Office of Rural Health and the Area Health Education Center, which I direct, and that's at Montana State University. We approve the training providers, and right now those training providers are our three regional AHEC direct centers. One is located at the Montana Hospital Association's Foundation. They have the MHA Academy, is an online training system, and they run that. Montana Health Network, which is in eastern Montana, and they also do a tremendous amount of training for their members. And Riverstone Health, which is in Billings, Montana, and they are a very large community health center. The way we pay for training, CHW is an approved training program in a grant that we have called the BWET grant, Behavioral Health Workforce Education and Training Paraprofessional Grant. That is a grant to our office. Organizations sponsor the trainees, so a hospital or a CHC or anybody who wants one is a program is an assisted living program for people with traumatic brain injury, for example. They sponsor the trainees, they pay the upfront cost, and then we reimburse them upon successful completion of the training. If somebody wanted to go through it as an individual, we could accommodate that too, but we're trying to match the training to actual jobs as the profession develops. And we also can pay for, out of our training, the UC Navigator training level 1 for people who want a more advanced care coordination training. We have regular courses, scheduled courses. Started kind of slowly, but it's really picking up speed, especially with all the funding for opioids in our state. The community health centers receive supplementary funding for OUD, SCD, workforce development, as did we. And so that's kind of increased interest in training. And we're also training a lot of critical access hospitals, just really all kinds of settings. And then we are developing an add-on module system around that, as Patricia mentioned, that knowledge area. One is geriatrics, which is a big issue in our state, especially in rural areas, and we have funding from the Montana Geriatric Education Center to develop that training. In Montana, Senate Bill 38 just passed a few weeks ago in the 2019 legislative session. It's a bill they've been working on for a long time, and it authorizes community integrated health for EMTs. And there is a state pilot project with 6 communities through the Montana Department of Public Health and Human Services EMS division. In preparation for this, we crosswalked the community health worker curriculum with the community paramedicine curriculum, and I compared all the competencies, and there's very little difference, just some minor things that could be supplemented. And so they're starting a pilot project with these 6 communities, and we'll be training 30 EMTs. I believe they're all EMTs. There may be a paramedic or 2 in there too, starting June 1 in the CHW curriculum, and we're very excited about that. So for more information, we have on our website at healthinfo.montana.edu. If you go into the behavioral health workforce section on that training and our other trainings, and Beth Ann Carter, who is also on this webinar, manages the training program for the behavioral health workforce projects, and she would be a great contact to learn more about anything you want to.